Welcome to the American Heart Association's Product Orientation for 2011 Heartsaver First Aid CPR AED course materials. Before we get started, take a quick look at your screen to locate the Media Player operating buttons. The Media Player operating buttons, usually located at the bottom of your screen, will let you pause, stop, and restart the presentation. To pause the presentation, simply click on the button with the two vertical bars. To restart, click on the arrow button. To stop, click the button with the square icon, and then to restart, click the arrow button. To move back or jump ahead, click and drag the bubble on the horizontal bar directly below the presentation. You can enlarge or reduce the screen size by clicking and dragging on a corner. This orientation will be most beneficial to you if you have the new materials in front of you while we review the information. If you haven't already, you may want to push pause now and set up your materials so you can better follow along as new features and changes are pointed out. Okay, let's move on to the Heartsaver Product Orientation for American Heart Association, Heartsaver, and BLS instructors. To begin, the AHA created this product orientation to help you better understand the Heartsaver product changes and help you use the new materials. This orientation will give you information about the new course materials, course curriculum updates, and how these changes affect teaching the course. We want you to keep in mind that this Heartsaver product orientation is different and separate from the 2010 AHA Guidelines Instructor Update. The Guidelines Instructor Update specifically addresses changes to CPR and ECC science. And remember, if you haven't already completed a 2010 Guidelines Update, the American Heart Association requires all U.S.-based instructors to have done so by April 1st, 2011. Instructors cannot teach the new courses until they complete the Guidelines Update. Remember, completing the Guidelines Update does not renew your instructor status. For your instructor renewals, contact your training center coordinator. As you use the materials and teach the course, you may find you need clarification on elements of science that are new or changed. If so, refer to the highlights of the 2010 AHA guidelines for CPR and ECC. The Guidelines Highlights and the Guidelines Update are both available on the Instructor Network at www.ahainstructornetwork.org. Go to the News tab and choose Guidelines. The new Heartsaver course materials and all upcoming new course materials have a revised look, featuring a new graphic design. Here you see the materials use photography of trained responders in action. The inside pages of the Heartsaver materials primarily use aqua blue, and you'll see light green as a secondary color. And all new products based on the 2010 AHA guidelines for CPR and ECC, from manuals to DVDs to course completion cards, have new product numbers. The numbers for products based on the 2010 guidelines begin with the prefix 90. So, for example, the new Heartsaver Instructor Manual is product number 90-1029. For the new Heartsaver courses, you will see that the course names are simplified and reflect the exact subjects covered in each course. The three updated Heartsaver courses released that we are discussing today are titled Heartsaver First Aid CPR AED, Heartsaver First Aid, and Heartsaver CPR AED. Because science indicates that the chance of survival is greater when high-quality CPR includes use of an AED, all AHA adult and child CPR courses will always include AED instruction. So to help increase bystanders' willingness to use an AED, you will no longer teach only CPR as in the former course, Heartsaver CPR. Additional Heartsaver courses will be updated in the future. Now let's look at the new Heartsaver instructor materials for the three updated Heartsaver courses. Rather than ordering a Heartsaver instructor package, all the materials you need to teach the Heartsaver courses are available for purchase separately. As in the past, instructors must have a new instructor manual with CD to teach the courses. For easy reproduction, the CD contains the files you will regularly use, including pre-course materials such as the equipment checklists and agendas. You'll also find testing resources on the CD like the Heartsaver skills sheets, critical skills description sheets, and the lesson maps, which are in print format too. What's important to know about your new manual is that although Heartsaver instructors can still conduct family and friends courses, you will see the family and friends course materials are no longer included with your Heartsaver instructor materials. And of course, instructors will need the new student workbooks. We'll look closer at the manual and workbooks in a minute. You must also have the Heartsaver DVDs to teach the courses. And now, all the Heartsaver lessons are included on the 2-disc set so that you only need one Heartsaver DVD package. The DVD set has all the lessons which provide cognitive information through dramatizations and demonstrations, and the video segments to use for practice while watching, along with segments for students to watch before they practice. All of this is available only in DVD format. The navigation for the Heartsaver DVDs is different and more flexible. From this menu screen, you see that the new DVD navigation allows you to select individual course lessons as needed. You can also select individual practice segments as needed. The DVD includes a new feature that automatically pauses before the practice segments so students have time to move to the mannequins. Then at the end of the practice segments, you will see 2 new icon prompts to choose from on the screen. You can choose the looped arrow icon to repeat the practice segment for more hands-on time, or practice again if there is more than one student per mannequin. Or choose the forward arrow play icon to restart the video and continue through the lessons. And now the beginning prompts are different when you start the CPR AED DVD. You will be prompted to choose if you want lessons that include child and or infant modules. You will no longer select your desired mannequin to student ratio. You will see that the Heartsaver instructor materials are simplified and include only one instructor manual. Your new Heartsaver instructor manual has 6 parts and comes with 6-page divider tabs as shown here. The tabs are labeled to help you organize your manual and easily find any section. Part 1 covers preparing for the course. Part 2 contains details for teaching the course. Part 3 is testing, remediation, and renewal. And Part 4 is course-specific details. Part 5 includes all the forms and additional instructor information like FAQs for both CPR and First Aid, which are included on the instructor CD. The FAQs provide answers to questions often asked by instructors and by students. The FAQs start on page 30 in your manual. As before, your instructor manual includes critical skills descriptions for adult, child CPR, AED, and infant CPR. These are also in Part 5. And now there is a new page of critical skills descriptions for First Aid. Of course, all critical skills descriptions for skills testing are updated to reflect new science. Look for them starting on page 33 in your manual. Part 6 is the lesson maps. Let's take a look at the lesson maps. The lesson maps, overall, have not changed in design or concept and remain very important to use in the classroom. To most effectively conduct the course, be sure to couple the lesson maps with the DVDs. This ensures that all the required course content is delivered to every class and that the students practice all the critical skills. The new Heartsaver lesson maps now come as one set, 63 maps in total. You can locate the necessary series of maps for each course by looking at the code in the upper left blue box of each map. Course outlines in Part 4 of the manual provide you direction on arranging the lesson maps for each course, depending on the modules you will be including. You'll also see use of the new icon mentioned earlier, the play icon, which is also a prompt on the DVD lessons, indicating it's time to start a DVD lesson. Now let's look at the student materials. There are 3 new Heartsaver student workbooks, one for each of the 3 courses that we're discussing today. The student materials are designed so that there is a workbook for each course. The workbooks have the same cover look and color scheme as the instructor manual. The workbooks are again in full color with illustrations. And the table of contents features a new notation in parentheses next to First Aid skills that students will be required to demonstrate. Specifically, you will see an asterisk followed by skill you will demonstrate. As in the past, the workbook is a student reference tool. Be sure your students have their copy to read and review before the course. Refer them to parts of the workbook during the course, and remind students to continue using it as a reference after the course. Remember, Providing students access to a workbook library is not acceptable. Refer to page 23 of the 2008 Program Administration Manual for more information on textbook policies. The student workbook again includes convenient reference materials for students. These are the Heartsaver First Aid Quick Reference Guide, the Heartsaver Adult CPR AED Reminder Card, and the Heartsaver Child and Infant CPR AED Reminder Card. The new student workbook does not include a CD. Any content on the CD that was for ongoing reference has been moved to the workbook. Although not designed as a requirement of the course, posters are available to use in any setting, such as common areas at work sites, schools, restaurants, workplace training rooms, or your training classroom. There are 6 posters covering CPR, AED, and choking emergencies. These are available for purchase as a complete set, or as a child-infant pack, an adult poster pack, an adult CPR AED pack, or an adult choking pack. The updated posters use the new Heartsaver color scheme and of course incorporate new science. The posters have been resized to 11 by 17 inches. The Heartsaver course completion cards and the Heartsaver Instructor card also feature a new look. Here you see the revised cards use the new AHA logo. The red bar on the left edge of the former card has been removed. The blue product color bar is at the top edge as before. You can see that the A, B, C, D, E module bubbles on the card front are replaced with text descriptors that will be simply marked through if students do not complete these modules. To help prevent card fraud, the security microprint embedded in the data lines is enhanced. Now the microprint is unique for each type of card. The new microprint is the title of the course in all caps with no spaces. Heartsaver First Aid CPR AED as one word, all caps, is the microprint used on this course card. On the back of the card, there is space added to fill in the Training Center ID number and the Instructor ID number. What is your Instructor ID number, and where do you get one? An ID number is generated on the AHA Instructor Network website when you create your profile. If you've already created your profile, you will see your ID number when you log in to the website. If you need help getting a number, contact your Training Center coordinator. As before, all cards will come on 8.5 by 11 inch sheets, and all cards use the peel and fold format and become two-sided cards after folding. A revised merge document template used to appropriately fill in the ID number and all data fields will be available to Training Center coordinators on the Instructor Network website in late April 2011 when the course becomes available for purchase. Important for you to know is that when students complete any of the 3 updated Heartsaver courses, those students must be issued one of the new Heartsaver course cards so that any optional modules students complete will match to the new card and can be correctly marked through if appropriate. The Instructor card uses the same new graphic features as the course cards. The security microprint also is enhanced for Instructor cards and uses the course title in all caps, no spaces. Heartsaver Instructor is the microprint in this case. On the back of the card, space was added to include the Training Center ID number. And the course location data field was removed and replaced with space to fill in the Instructor ID number. A revised merged document template used to fill in the data fields will be available to Training Center coordinators on the Instructor Network website in late April 2011 when the course is available for purchase. When you're issued the new card at your renewal, the card will have your name on the front and your ID number on the back. Current Heartsaver instructors with valid cards do not need to have this new Instructor card until they renew. Remember, all BLS instructors can teach Heartsaver courses, and a separate Heartsaver Instructor card is not needed. Before we look closer at changes to teaching the course and updates to the course content, let's first discuss the options of what you might present at a course, depending on your students' needs, along with the time required to complete the course and optional modules. As we talk about course content, remember that AED is now always taught with adult and child CPR. And for Heartsaver courses, CPR always includes adult CPR, while child and infant CPR are optional modules. Let's review how course time is determined. The times here to teach a Heartsaver course are based on results from new product pilot testing with a ratio of 6 students to 1 instructor to 2 mannequins. The time needed to complete courses and modules may vary, so the times listed here are estimates and do not include breaks. So, for example, a course may include CPR AED, which will be the standard adult course content. This requires about 1 hour and 30 minutes to complete. Here are more time estimates to complete other course modules. You can also estimate course times for the first aid CPR AED content in the same manner. Again, course times may vary, and these times are only estimates. For example, the course may only cover first aid. This will take about 2 hours and 45 minutes to complete. Here are more time estimates to complete other course modules. And with all of the new Heartsaver content included, the course and modules require 6 hours to complete. Let's review updates to the Heartsaver curriculum. We won't review every science change here, but what's important for you to know is that the new science updates are incorporated into the video lessons on the course DVDs. This will help you convey key science changes to students and do so with a consistent delivery method. First, let's briefly review course objectives. As before, students will be tested only on critical skills. However, the course teaches more than just the tested skills. You can find both the psychomotor and the cognitive course objectives along with the course completion requirements in your instructor manual. Page 15 outlines objectives for the CPR AED course, and page 19 begins the objectives for the first aid course. Let's look more closely at the new science information in these courses. The most notable science change in CPR is the sequence of steps changing from ABC to CAB. All course materials reflect this science change. Also updated are the age groups for CPR and AED use. For CPR, a child is defined as someone 1 year old to puberty. However, for AED use in children, the age for child is still 1 to 8 years of age. The differences are covered when you get to lesson number HS CPR C14. Switching rescuers is now demonstrated in the DVD lessons. New course materials stress the importance of high-quality CPR and that giving compressions correctly is tiring and can result in less effective compressions. The recommendation is to switch rescuers every 2 minutes when there are 2 or more trained rescuers present. There is now added content to help rescuers understand how to do this effectively. However, switching rescuers is not a course objective and is not tested. Let's cover a few key points on first aid. The 2010 AHA guidelines for CPR and ECC now recommend that first aid providers give aspirin for heart attacks. First aid providers should activate the EMS system first for anyone with chest discomfort. Then, while waiting for EMS, first aid providers should make sure that the person has no allergy to aspirin, no serious bleeding, and no signs of stroke before giving that person either 2 low-dose aspirins or 1 regular aspirin. You'll also see other new first aid content included in both the video lessons and student workbook, including use of tourniquets, how to assemble and help with an inhaler, and expanded information on heat emergencies that covers heat cramps, heat exhaustion, and heat stroke. This new content is for students to learn and understand. However, the content is not included in psychomotor course objectives and is not included in skills testing. Last year, the AHA First Aid Subcommittee determined that the Environmental Emergencies module is important enough information to always include and should not be optional. The Environmental Emergencies module is now part of every Heartsaver First Aid course. Lesson 20 and 21 cover environmental emergencies. Now let's cover some updates to teaching the course. As before, you will continue to use key instructional tools to deliver the course. This includes your instructor manual, lesson maps, the course DVD with lessons, and the instructor CD with all necessary forms and checklists. Look at Part 2 on page 7 in your instructor manual for instructions on using lesson maps, lesson identifiers, and lesson identifier codes. Now we'll talk about skills practice. What you might notice as you move through the course and lesson maps is that some skills are no longer practiced. Specifically, relief of choking is no longer practiced. Students don't gain realistic practice performing abdominal thrusts on mannequins, and practicing on classmates could potentially cause harm. Also, look, listen, and feel was eliminated in the new 2010 guidelines. So during finding the problem, students will no longer practice checking for breathing by opening the airway, but will look for signs of breathing by scanning the victim's body. Also, students will no longer practice treatment for shock because new science states that there is no need to raise a shock victim's legs. So the only recommendation for treating shock is to cover a shock victim with a blanket, which does not require practice. Skills testing has been revised to reflect the 2010 guidelines. We will first look at CPR AED skills testing. You can find instructions for conducting skills tests in Part 3 of your manual starting on page 11. In Part 5 on page 39, you'll find the skills testing sheets for adult and child CPR AED. And on page 40, you'll find the skills sheet for infant CPR. Again, the adult and child CPR AED are differentiated, so you will see the skill sheet provides separate columns, one for adult CPR AED skill testing and one for child. Now let's look closer at each sheet. Again, the objective is for students to learn and perform each requirement according to the skills sheets. You will use the sheets to test and validate students' skills. As explained with skills practice, opening the airway and checking breathing were part of the former initial assessment step, look, listen, and feel. Students will now be tested on checking the victim for no breathing or only gasping. This change is also reflected in the DVD lessons and the student workbook. In Step 6, note that students' hand position is no longer evaluated on between the nipples. Instead, the correct hand position is placement on the lower half of the breastbone. And as you would expect with the new CAB sequence, opening the airway and giving breaths are now completed and evaluated in Step 8 after the first set of compressions. The 2010 guidelines reflect that an AED is simple to use and requires only 2 steps. Turn it on and follow the prompts. Following the prompts is primarily a cognitive skill. It's the ability of a person to do what he or she is being told to do, and memorizing the prompts could complicate learning. So you'll see course content on using AEDs is now simplified, and the lesson on using an AED is a short practice that focuses on the psychomotor skill of turning on the AED. This means that students are tested only on turning on the AED. Here's the new infant skills sheet for testing. Again, the objective is for students to learn and perform each requirement according to the skills sheets, and you will use the sheets to test and validate students' skills. As with the adult skills sheet, look, listen, and feel has been removed. Instead, rescuers are tested on checking the victim for no breathing or only gasping. Most people are comfortable performing mouth-to-mouth on an infant, and it is the method used more often than giving breaths with a mask. So, you will see that the use of a mask with infants is now optional and not included on the new skills sheet. For students who are at workplaces or businesses that frequently or always have infants on site, including instruction on use of a face mask is recommended. You will also see in the course lessons and materials that the placement of one hand on an infant's head is no longer a demonstrated or accepted practice. This also applies to CPR for children. Again, the goal is for students to learn and perform each requirement according to the skills testing sheets, while you use the sheets to validate student skills. The most significant change to Heartsaver skills testing is the addition of first aid skills. In the past, students only practiced first aid skills and were issued a card that stated that they had successfully completed the objectives and skills evaluations in accordance with the curriculum for the AHA Heartsaver First Aid Program. The AHA has further defined its first aid program so that first aid skills evaluations involve both first aid skills practice and skills testing. The Heartsaver First Aid skill sheets are in Part 5 of your manual on pages 41 and 42. You can see the sheets follow a format similar to CPR by listing step numbers, describing the critical performance steps, and providing room to track whether students complete the skills correctly or not. First aid students will practice and be tested on removing gloves, finding the problem, use of an epinephrine pen, and stopping bleeding and bandaging. Note that bandaging is no longer optional and is a required part of the course and skills testing. The only optional first aid skill is splinting practice. This is covered in Lesson 17A. In addition to the skills sheets, the first aid critical skills descriptions on pages 37 and 38 are a good reference tool to help you validate performance of critical skills during testing. The AHA offers web-based e-learning courses including Heartsaver First Aid Online Part 1, Heartsaver CPR and AED Online Part 1, and Heartsaver First Aid Online with CPR and AED Part 1. These courses are being revised to reflect the 2010 guidelines and will be released later in 2011. Upon release, the new course information will be sent to training center coordinators and posted on the Instructor Network. AHA instructors will continue their integral role in conducting skills practice and testing sessions for AHA e-learning students. As with the classroom-based course, instructors will use the revised skills sheets for testing. And until new e-learning courses updated with new science are released, e-learning students will be directed to an informational page with resources for the new science and the interim skills testing sheets. You should be prepared to discuss new science updates with these students before their skills practice and testing. For details, refer to the March 15, 2011 training memo incorporating 2010 guidelines to AHA e-learning programs and skills practice and testing. It's available on the AHA Instructor Network under News. After students complete a course, AHA requires instructors to collect a course evaluation form from all students. The course evaluation form should be used for all AHA courses, and the most current evaluation form is available on the Instructor Network website. Overall, the Instructor Network is your resource to get the most current evaluation form and other revised forms, such as course rosters and equipment lists. It's an exciting time as AHA instructors deliver training with new life-saving information. As the Heartsaver courses and others become available, please remember that your first and best resource as an instructor is your training center coordinator. Your training center faculty is another valuable resource. And the Instructor Network website is the key place to find updates and information about products, AHA activities, course forms, and more. Watch the Instructor Network for release of new product updates, new tools, and course tips. The AHA will continually develop best practices to help you enhance delivery of AHA courses. This concludes the Heartsaver Product Orientation. The American Heart Association would like to thank you for viewing this orientation, and we hope it helps improve your experience in teaching the new Heartsaver courses.